Nothing unusual the day before. In fact, went to bed that night and at 6:30 in the morning, I got up, went to the bathroom, came back to bed.
And I just kept feeling his body quivering. And I'm talking to him, I'm noticing that he's moving the right arm, but he's not moving the left arm. I put my hand in his left hand and I said, squeeze my hand.
Went to reach across with my right hand to squeeze her hand, not realizing until she told me later that she actually had my left hand, but I didn't know it.
That's when I was just like, he's having a stroke.
I was the person who would go into the doctor once a year, have your blood test, and they'd get the results and say, okay, you're boring, come back in another year. Up until December 31st, 2021 was the blood test. That's where we realized he had prostate cancer. Had a pacemaker put in, and then hole in the heart was plugged up, and then the stroke happened, I think it was July 14th was the actual day of the stroke.
My first immediate thought was, he's too young for this. You know, it's like at one point you take off the wife hat and you put the nurse hat on. So I started with the assessment process. And I knew, as someone who has worked with stroke victims in the past, I knew what to look for. When I saw that he was only moving one side of his body and the other side wasn't moving at all, that was a tip right there. That perhaps if I wasn't a nurse, I wouldn't have noticed it. I also knew the value of getting immediate care.
At Silver Cross Hospital, our goal is to be a destination neuroscience program for the Chicagoland area to cover everything from general neurology, subspecialty neurology, neuroendovascular, as well as complex neurosurgery care. Our market shows the need for 8 neurologists, and we currently have 3 neurologists on staff. There is a national shortage for neurology, and when we can't recruit enough, we partner with some of the best experts in our market. In March of 2022, we partnered with the University of Chicago Medicine to bring neurology and neurosurgery services to our organization. What this means is that faculty from the University of Chicago help provide 365, 24/7 coverage for these services, including Drs. Peleg Horowitz, Dr. Paramita Das, Dr. Tara Kesshout, and Dr. Michael Hurley, providing not just the pathways and protocols of their national and international programs, but also the breadth of programmatic knowledge to really advance what we're doing here to Silver Cross. We also are able to recruit our own Dr. Matt Reynolds, who is uniquely trained in both neurosurgery and neuroendovascular. So he can actually work both sides of our service line. He can do cranial surgeries, he can do spine surgeries, but he also can be the one to go in a catheter-based approach and pull those clots out. There aren't very many surgeons or physicians that are dually trained like that, so we're really lucky and blessed that he made the decision to become part of the Silver Cross family. Dr. Matt Reynolds partners with our 2 nurse practitioners, Diana Stefanik and Heather Kruzmark, as well as working very closely with Dr. Tara Kesshout.
The neuroscience collaboration between Silver Cross Hospital and University of Chicago Medical Center is bringing you the best medical and surgical care to your backyard. What that means is bringing the best care in neuroscience, neurology, stroke, and neuroendovascular surgery to the patients of Silver Cross. Now, if you have a complex aneurysm, AVM, or a stroke, you do not need to go through the inconvenience of coming to Chicago downtown. We will come to you in Silver Cross.
There are 2 different types of strokes, acute ischemic stroke and also hemorrhagic stroke. Ischemic strokes are caused when a clot forms and blocks the blood vessel to an area of the brain, and so it's deprived of oxygen. The brain cells begin to die at a very quick rate. Hemorrhagic stroke is when there is a burst blood vessel, so there's bleeding into the brain, and although this is less common, it's a higher mortality rate. These patients still need quick care, and there's really no way to know the difference between the 2 types of strokes until we get our CT scan. About 85 to 87% of all strokes yearly are caused by a clot or an ischemic stroke.
Advancements of stroke care has been amazing over the years. We initiated a telestroke service. What that means is, with the touch of a screen, one of our expert stroke doctors will be available to look at your imaging with CT scan, CT perfusion, CTA, and evaluate you over the camera and immediately recommend what's best therapy for the patient. Time is brain, which means every minute counts for best outcome.
Every code stroke patient that comes through here gets a plain CT of the brain. This will rule out a bleed right away. So sometimes a stroke caused by a clot may not show up on CT scan for up to 72 hours. So we use the CT scan to rule out the bleed.
Now we can offer tenecteplase, which is a newer generation of clot-busting medication that can resolve the clot immediately for better outcome.
There's a very tight window of when the symptom onset occurred to when this drug can be administered. So it's in certain patient populations up to 4.5 hours from the last known normal.
We have a software called Viz AI, and that software really has increased and improved the time by which our images are processed.
What Viz AI does is take the scans right from the CT scanner, kind of uploads it into this HIPAA-protected cloud, and use the software to kind of identify if there is a clot in that large vessel. And we'll send an alert out to the entire team that's on the Viz app. They all have access to this app and can communicate with the entire team. It's really helped us to get our patients to the cath lab much quicker. We provide mechanical thrombectomy as treatments for acute ischemic stroke. Mechanical thrombectomy is essentially cath lab for the brain. A catheter is inserted through the groin or sometimes even through the wrist. It's a minimally invasive procedure, and that catheter then is threaded up through the neck arteries up to where the clot is, and we just pluck the clot out and restore blood flow to that part of the brain.
So again, you have this multidisciplinary team teed up. You've got the teleneurologist waiting, physically examining the patient in partnership with the emergency departments, physicians, and nurses. You have Viz AI really expediting the time that we're identifying these LVOs in the images. And you now have this multidisciplinary communication platform that everybody is talking to each other in this same HIPAA-compliant chat room, if you will, and they can actually activate the code stroke team from that app. So right within 5 minutes, they can say, time for a stroke, get the lab ready, let's go. These are really the technologies and the ways that we've aligned our multidisciplinary teams to ensure that we are all working together to get those patients to the lab or to the appropriate treatment plan as soon as possible.
What was great about John's case is that his wife recognized his stroke symptoms immediately and called 911. We were alerted ahead of time that he was on his way. He was able to get to the CT scanner immediately, and we could see that this was not a bleed. He would be in the window to receive thrombolytics. We had everything ready to go for him.
So when I got there, he was already in the room. Genevieve was telling me, what they were doing, that they were starting the clot buster medication, and explaining also, what the x-rays showed, what the CT showed, where the clot was. They were, like I said, I couldn't say enough good things about them.
The only emotions afterwards were, they were talking about rehab, and I'm thinking, okay, rehab is going to make everything well. Not realizing how long that things can take, and things come back, but not when you want them to.
The really nice thing about having Shirley Ryan Ability Lab here at Silver Cross is that we have access to the #1 rehabilitation hospital in America for the last 33 years, according to US News and World Report. So this allows us to take care of patients that come in through Silver Cross or from outside hospitals that have had neurological injuries, brain injuries, strokes, and we give them 3 hours of therapy a day. They've got really close nursing care like they get in the hospital level, and they get physician visits daily. John came to us after this stroke that he had. He needed a comprehensive rehab program, which included physical therapy, occupational therapy, and speech therapy to address all of his functional deficits. Depending on the severity of someone's stroke, a patient could be with us anywhere from 1 week up to about 30 days. Our average length of stay here is 12 days. John was in and out in a week. This is really a testament to the fact that he got to the hospital quickly, had a neuro intervention done, and his residual deficits from the stroke, which could have been devastating based on the location, they were really pretty minimal.
Silver Cross Hospital offers a stroke support group. We meet monthly on the 3rd Wednesday of every month from 4 to 5 p.m. We have opened this up to any stroke survivors. You do not have to have been treated for a stroke at Silver Cross. We try to bring up different topics that help the survivors. We've done family and friends CPR. We've gone over different adaptive equipment with occupational therapy and include guest speakers. It's just been very inspiring to the other stroke survivors in the group and therapists that have had to treat stroke patients, and kind of just offers a new insight to kind of what that patient goes through during their recovery.
If you or your loved one is experiencing stroke symptoms, that could be a facial droop, that could be difficulty speaking, that could be inability to walk or raise your arms up, that's a 911 call to bring you to a stroke center such as Silver Cross Hospital.
Silver Cross Hospital has been designated as a primary stroke center by the Joint Commission for more than a decade. On average, we have 700 to 800 code strokes a year, and of that, 30 result in a mechanical thrombectomy. What's interesting though is we had 8 mechanical thrombectomies in March alone. What that means is people like you are becoming more educated in BFAST and other tools to identify stroke symptoms. When patients get to us sooner, we have a lot more options for them to give them a higher quality of care on the other side.
We adopted the BFAST acronym. B stands for balance, loss of balance, or even a sudden onset of dizziness. E stands for eyes, and that could be a change in your vision. F stands for face, so that's where we look at facial drooping, asking someone to smile, is their face uneven? A stands for arms, and that's when you have a patient raise their arms. They could have weakness on one side. The S stands for speech, so this can be slurred speech, difficulty with speech, or difficulty understanding speech. And then T is for time, so it'd be time is tissue, want to know the time of their last known well, time to call 911 or seek help immediately.
I can tell progress more and more often, stuff like that. I'm noticing more things in the left side vision. I realized a lot of my recovery going fairly quickly probably had a lot to do with my wife, who's the nurse, calling 911 right away and getting me in the hospital right away.